I'm Jim Basilion. I'm a full professor at Case Western Reserve University. One of the more exciting roles that I play at Case Western is to be director of the NFCR Center for Molecular Imaging, where we try to introduce new molecular imaging concepts into science and translate them. There's about 200,000 cases of breast cancer every year in this country, and about 75% of those are candidates for lumpectomy, rather than removal of the entire breast. And so the lumpectomy is where the surgeon removes a lump of tissue. You can actually think of it as a hard-boiled egg in size. And that surgery is successful and considered a surgical cure if the surgeon removes all of the cancer. And the way that that's determined is they take this lump-like tissue, or this hard-boiled egg, and they give it to pathology. They slice it, they look at the margins, they look at the edge of the lump, and they look where the cancer is within that lump, and if it's 2 millimeters or greater on average, that would be considered a successful surgery or surgical cure. If it's less than that, the women will be called back for more excision or more resection of the tumor to remove what was left behind. The number of women that have to come back are 40 to 60% of the population that undergoes a lumpectomy. So we wanted to impact this surgery. We wanted to make it better, and we wanted to make it so that the women didn't have to come back. And so what we came up with was a technology where we could interrogate a biomarker and to exploit these probes for real-time imaging of lumpectomy samples. And so you can actually detect cancer on the surface of this lumpectomy very rapidly, in literally 5 to 10 minutes. And so you could inform the surgeon in real time if that lump has had cancer at the surface or not. And if it does, it means that it's an incomplete resection. And so rather than those 40% of women going home and waiting 5 days for the pathology report, we can give them a report in real time. The surgeon can resect a little bit more tissue, check it again with the same procedure, and get a 100% removal of the tumor prior to sewing the patient up and sending them home, and hopefully we'll reduce that re-excision rate from 40% down to, just a few percent.